For our machines, we have flash steam sterilizers that are used for flash sterilization, and we have liquid peracetic acid, the STERIS System 1, which are used to sterilize in the operating room. And now we have an opportunity to go with a system like, for example, the STERIS NX, which is a small machine that is not intended for just-in-time sterilization at all. In fact, it's not used that way. It's not intended to be used that way. It shouldn't be used that way. AAMI guidelines are, even though the document is called Comprehensive Guide to Steam Sterilization and Sterility Assurance, it covers all the basics of sterilization in general, you know, packaging and cleaning and all that, all those steps. And that should be reviewed anyway, periodically, because we write those standards and update them yearly. So Amy has a lot to say about all the different aspects of sterilization, as well as the AORN recommended practices. And I think if you look at those guidelines and you follow them, you'll be doing the right thing. And as I said, Amy doesn't recommend flash sterilization any more than the CDC does, or just in time. It really focuses on terminal sterilization. There's a section on flash sterilization, but it will really walk you through what you need to do to sterilize properly. I think it's a hands-down no-brainer that it's now time to go to terminal sterilization. You may ask, why hasn't this occurred sooner? Why didn't people do this? Because the standard hasn't changed. It's always been, the gold standard has been terminal sterilization. But, you know, we've had systems in place. They work. You're in the operating room. It's a fast-paced, high-tech environment. Go, 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 go. And now you have to step back, take a few minutes, and kind of do things a little bit differently. That will take a little bit of an interruption from your day. We've got a system that works. Don't mess with it. But now it doesn't work anymore, and it's time to mess with it. But what we're going to do is end up with a much better process. So it's really a matter of convenience. I think that's why people didn't transition sooner, although many did. And putting an NX, for example, in the operating room, they're not everywhere, so it's not something people were totally familiar with. Typically, they've been in the sterile processing department. But as I said, they're small enough to fit in an operating room and to be used for terminal sterilization in place of flash and in place of STERIS System 1. I would recommend that people who are transitioning take a really good look at the STERIS NX. I am very familiar with that technology. The sterilizer is compact, it's easy to operate, you'll get a terminal product at the end of the process, and it's one of the alternatives that the FDA has listed on their website. It's the one I'm very familiar with, and I certainly think people should take a really good look at it. It can be done, and it should be done. By going to terminal sterilization, you decrease the risk of contaminated instruments, which decreases the risk of a patient incurring a surgical site infection, which is all part of patient safety goals, preventing patient injury. It's the gold standard. Terminal sterilization is the gold standard. I can think of no reason why one shouldn't transition to it, and now is the perfect time.
Thank you very much, Cynthia. That was a fantastic overview of the standards, the practices, and more importantly, the practical solutions that we need to get ourselves to that next standard, as Cynthia called it, the gold standard. So now let's get to the important section, addressing the questions that you have sent to us. For that, I'd like to introduce Jeff Castillo, who's our Director of U.S. Marketing. Jeff, thank you.
Thank you, Karen. Again, I'd like to introduce myself. I'm Director of U.S. Marketing. My name is Jeff Castillo, and I would like to take this opportunity to thank all of you for taking time from your busy schedules to participate in this webinar. The participation has well exceeded our expectations, and it's comforting to know that in today's world where healthcare is on the forefront of all activities in the media, that there's still folks that are out there that are primarily concerned with the outcome of our patients and the safety. In preparation for this webinar, we received numerous amounts of questions. What we've done here is highlighted the most commonly asked questions. For the remaining questions, we are going to post it on our website, which is aspjj.com/alternatives. At that website, all the other questions that were submitted will have answers. With that being said, let's go to the first and most commonly asked question. Does the extended timeline change or delay the need to transition? Yes, it does. The simple answer is you've been given a extended time to implement a proper transition plan. However, it's important to know that as every day passes and the System 1 is being utilized, the device has been misbranded and is adulterated. It's important to understand that we, as well as healthcare facilities, have a responsibility to put patient safety first. We suggest that you act with the utmost urgency in finding an alternative, and we are happy to say that at ASP we have a legally marketed alternative for System 1 with our STERIS NX systems, as well as the Evotech endoscopic cleaner and reprocessor. Another question was asked are, what are ASP's FDA-cleared alternatives to STERIS System 1? Rest assured that all the ASP products that we have available today have been legally marketed. We've mentioned the NX. You've heard Cynthia talk about it specifically. We do offer terminal sterilization with that product, and we also talked a little bit about the Evotech and its cleaning claims and high-level disinfection for endoscopes. I would also, again, encourage you to go to our website, which we built in support of this activity, which is aspjj.com/alternatives. Do we have enough supply to meet the demand? This is a fair question. We have significantly ramped up production. We've also made sure that all consumables in support of our capital equipment has all the measurements in place to meet the demand. But of course, in any event of this magnitude, it's important to understand that the sooner an order is received, the better we can anticipate and meet the customer needs. What small diameter scopes can be processed in the STERIS NX system? I'm glad to say that all the major producers and manufacturers of scopes, such as Olympus, Karl Storz, Richard Wolf, and Gyrus, have announced that certain flexible scopes can be processed in the STERIS NX system. We also have provided numerous tools for you to be assured that what you're utilizing can be processed in our technology. I would encourage you to find access to the sterility guide through your local representative, where you have all the endoscopes that can be processed placed there for reference. And ultimately, the safest way in assuring this is contact your endoscope manufacturer directly and ask them what could be utilized within our technology. How quickly can STERIS NX system reprocess instruments? This is a great question. The STERIS NX system has a 28-minute cycle. It ensures fast terminal sterilization turnaround. We also have an extended cycle that could be utilized for single-channel flexible scopes. On the aspjj.com/alternatives website, there's a piece that refers to what can I sterilize in my STERIS NX. I would strongly encourage you to visit that, where we highlight what exactly could be processed there. But the bottom line, and I want to assure you all, that the STERIS NX system is a great fit for your OR and your patients because it offers terminal sterilization, an important differentiation. When the instruments come out of the STERIS NX system, they come out sterile and ready to use either right away or at a later date. The system is just one part of our offering at ASP to help you optimize your sterilization within the operating room. So are we offering any financial incentives to turn in your STERIS System 1? Yes. Again, another piece that's on our website is ASP's Alternative Promotions, which provides a $6,000 discount off the price of your STERIS NX system when you turn over a STERIS System 1. We've also identified numerous financial services and packages in support of this activity. Why should I consider an alternative from ASP? Well, we as a company at ASP have had more than 20 years, and our technology is placed in thousands of facilities around the world. We are known as an infection prevention leader, and our products provide a safe environment for patients, their families, and the communities we serve. Our suite of low-temperature sterilization and high-level disinfection is well-versed, and well-tested, and has proven that over time it is one of the preferred devices in use. In fact, if you talk to leading MDMs, you'll see that they endorse our STERIS technology for their devices. We have ramped up everything in need to successfully transition you to the NX OR solution. We ask that you carefully consider this, look at all the alternatives that we've offered. We are here to serve you in this time of need, and we take this time very seriously, and we want you to be assured that everything that we've have in place has been carefully thought through, and we want to assure that ultimately that we come together and serve the well-being of our patients.